Hi, everyone. It's Rena Jadov, and today we're chatting with Dr. Lee Erin Keneally about how to find the right cancer doctor, the right oncologist. Hi, Dr. C. Welcome.
Hi, Rena. Great to be with you again.
So, it's so tough when you have cancer, because I had it, when you have your colon cancer and you're out there, and it's just so hard to pick the right doctor. So, now that I've been through it, I had some terrible doctors. I luckily had a couple of good ones too. I've realized how important it is to have a checklist of questions to ask. So would love for you to share with our listeners what should be on that checklist and how does someone pick the right doctor the very first time?
Well, I think you'll never know until you meet the person. So I think you'll look at their website, see what their personal interests are, because you're basically putting your life in their hands because they are the authority. And I would not rely on one doctor. I'd encourage all of my patients. I had a brand new patient come in last night. She just was diagnosed. She felt a lump and then had gone and got testing and brand new diagnosis of cancer with proven with biopsies. And so she was really concerned about the doctor, and she says, Dr. Keneally, I already know of you. I already know what you do. I'm more interested in what you have to say. And I said, well, do you have a surgeon? Do you have an oncologist? And she says, yes. And I said, look, I want you to go visit and see those doctors. I want you to hear their expertise to each doctor. So you always, because I tell people 2 heads, 3 heads are better than one. And no one person can know everything and have the corner market on the market cornered by any means. Okay, so and everybody, and then you'll know you're going to make your own decision. This is your life. The second thing is, does the doctor really care about prevention? Does the doctor care? Has he asked you about your lifestyle? How do you sleep? How much water do you drink? How do you eat? What kind of stress do you have? How do you really feel every day? How do you physically feel every day? Is he going to do a panoramic blood test of everything to make sure all your vital functions and hormones are working for you? Is he checking your vitamin markers? As I said earlier, World Health Organization publishes that the reason why we have so much cancer is diet and lifestyle. So if the doctor is not talking to you about that, I would be hesitant. The other thing I always tell patients, I want to know if a doctor's ever been really sick before.
Oh, good one.
If the doctor hasn't really been sick, how is he or she going to relate to you?
Absolutely.
It's just like the neurosurgeon who had a near-death experience and then he wrote a book on it. And it changed his whole way to practice medicine. And he's not the only doctor. There's lots of doctors like that, including myself. So the first question I would ask is if you've ever been seriously ill. Because why? You are not enlightened to really, really, work beyond the call of duty for that patient if you haven't been sick, okay? It's like trying to explain to a woman who's going to have a baby what it's like to have a child.
Yeah.
They aren't going to understand it until they have that child.
Mm-hmm.
So I know it sounds like really kind of unusual, but if I have a serious condition, and I consider cancer a very, very serious condition, I want to know that my doctor is looking at every nook and cranny and looking at the entire tapestry of the body to make sure that everything is working and I have checked everything. So, and usually a doctor is not enlightened and awakened until they have been seriously ill. It changes the way their compassion and understanding of you comes through. Now, the second thing is, like I said earlier, is the doctor addressing how you live every day? Is he addressing how you feel? Is he addressing how you sleep? Is he addressing your fear? Has he addressed your emotion? Has he addressed if you exercise or not? Has he addressed, do you have proper nutrient levels? Do you have a proper gut that works, that can take care of you? All of these things. Taking care of your body is not a simple task. It is a very, very complicated task. We make it seem like it's 1, 2, 3, and you're done. There is no such thing to the simplest task, much less a cancer that's been growing for 10 or 12 years. So don't think you can just do surgery, chemo, or radiation and be done in 3 or 4 months and that cancer gone. It's impossible. I'm telling you, it's impossible. So it's not that easy. Being healthy is not easy. People always say, oh God, Dr. Kino, you look so great. I go, you know what? I work at this. You know, this is not an easy task every day to do. I work at it because we've kind of lost the art of discipline. I know I grew up a long time ago, so things were a lot more disciplined than they are now. Now it's like a free-for-all and like you can just do anything you want. But that's not how the body and the mind works. The body and the mind works with order and discipline. And we need to honor and respect the order and discipline of our body. And fortunately, I had a mother who was very, very fanatical about the order and discipline. I did go to Catholic school. That also helped. I did play the organ 6 days a week, so that helped. I was a pianist. You get disciplined because you have to practice. And so, but we lost the art of discipline and order. And discipline is the foundation of progress. And so, and I teach my own children this because we all have to be disciplined on how we live, from how many hours we sleep, the water we drink, the foods and the quality and the type of foods we eat, our interactions with human beings, how we manage our stress. Every single thing matters, and small, little things make huge differences. Now, there are organizations, doctor organizations, ACIM Connect, we will put in our paperwork, acimconnect.com. There's the A4M Physicians, which is the anti-aging group. There is acam.org, I think it is, acam.org. So there's already doctors who are what we call functional integrative physicians. And I recommend that you see a medical doctor because the medical doctor will understand the science of your blood work. I wouldn't rely on another kind of practitioner because I know that the training of a medical doctor can ascertain. Now, there are other people that you can use, people who are massage workers, body workers, emotional workers, maybe a health coach to be your cheerleader. Yes, you can use all those, but your medical doctor should be your quarterback. Now, there's going to be, I will tell you, there's different levels of doctors. There's doctors that are just starting this. Yes. There's doctors who've been doing it 5 or 10 years. And then there's doctors who've been doing it for 20 plus years. So if you really have cancer, you should be with a doctor who's been doing it for a very, very long time. And the reason is there's nothing like experience. There's nothing like the 5 days a week seeing patients, learning what works, what doesn't work, what kind of work. I have heard hundreds or thousands of experiences of patients. So I hear what they're saying. I know how to ascertain things. So I know new doctors that I trained, they just don't. Yeah, exactly. So it takes time. So probably the longer they've been doing that, Rena, the better.
What would you say is the minimum? If you had a loved one that you needed to pick a doctor for, what would you say is the minimum number?
20 years, 20 plus years.
Okay. And is there a difference between, say, a doctor, a cancer doctor, an oncologist that's just been focused on a body part? So let's just say, colorectal cancer versus someone who's a generalist. Is there a difference or not really?
Right. Well, oncologists strictly take care of all kinds of cancer patients, all kinds of diagnoses, and their goal is to get rid of your cancer. They are not your quarterback. They're not your general medical doctor who's taking care of you. They're just administering the chemo.
Oh, I see.
Yes, and ordering scans and maybe doing minimal blood work. That's all oncologists do. But they don't look at the head to toe body because they're focusing on killing the cancer. Whereas I'm focusing on supporting the body for whatever we're going to do. If we're going to do chemo or surgery or radiation, I need to support the whole body healing, and I'm concerned about getting rid of the cancer.
Oh, see, I completely misunderstood. And this is someone who's had colon cancer and gone through surgery. And I still thought that the oncologist would be your first stop. And so you're saying, your first stop actually needs to be way before that to find the right doctor that's integrative and all the things you mentioned. And if the decision is made that you should pursue chemo or radiation, then at that point you need to add to the support network of yours an oncologist. Is that
Correct.
your statement?
That's correct. And I usually encourage always the patient to see an oncologist because I want the patient, it's very important for the patient to be fully informed.
Absolutely. So when you're talking about find someone who's had 20 years of experience with cancer, you're not talking about an oncologist, you're just talking about an MD that has had 20 years of
Right.
experience.
Yeah, in cancer, right. And obviously, a young doctor, let's say it's a young doctor who just finished fellowship in oncology. I mean, he hasn't listened to 1,000 people. So he or she may be really good and very sensitive, but they're going to stick by the book because that's what they know.
Right. Okay.
So as doctors matriculate, they learn this. They learn their style, what they find works, and develops
Like
it themselves.
Yeah, like
Exactly.
in every gift, you develop your own secret sauce of healing. So of all the wonderful things you mentioned, what's the one thing, what is the most important thing you would say, or an important question in asking your doctor before you go ahead?
If they'd ever been sick.
Okay, there you have it. Wonderful. Dr. C, thank you so much again for sharing these wonderful questions. For the rest of you, please check out the Beat Cancer Bootcamp. We are the 14-day online live program to help you prevent it, beat it if you've got it, help your loved ones, make sure your family stays cancer-free. And if you have it, check out these questions, share it with those that are looking for a doctor, and stay smiling. We'll see you on another.